Okay, everyone. So today I'm going to talk for about an hour or so on NIH policies. Let me move the people there. Okay. So I'm going to go over some common NIH policies that you may not have heard of, but I guarantee you've likely completed administrative tasks related to them. So it's just sort of connecting the dots and demystifying why is the Vanderbilt team or why are our US collaborators asking us for all these codes and forms and whatnot. I'll review the policies and the tasks you as an administrator might be responsible for or related to the policies. But if you would like to learn more about these policies, you'll find full-length training videos under our resources section on the GAIN website. So before I dive in to policy, I'm going to go over a refresher about required NIH registrations. We did cover this in GAIN Part 1, but we have some new members, so we thought it would be good to go over it again. So my first poll is, excuse me, does your institution have a SAM identifier? Remember, this is anonymous. This is just to kind of gauge who has what. Okay. All right, so 64% said yes. The rest of you maybe no or I don't know. There we go. Next question. Does your institution have a UEI number? This is a new code. Oh. I don't know, it's creeping in.
That's all right. This is a safe place. You don't have to know.
Oh, exactly. You're like, ugh, what is she talking about? All right. Okay, good deal. Thanks for answering that. I don't know. I feel like you have to click 15 things to share a poll. Okay, so the first thing I'm going to talk about is SAM and the UEI. So your organization must be registered in multiple systems in order to apply for a grant through the NIH or other US federal agencies. It's important to determine who from your institution is responsible for doing this, as these registrations must be done on behalf of the entire organization. So SAM registration is required for any organization that's applying for a grant or contract. This takes a bit longer the first time, usually a couple of weeks, and needs to be renewed annually, but the renewal doesn't take very long. The unique identity identifier, or the UEI, it replaced the DUNS number. So if you all know DUNS and have had experiences where you're trying to hunt down your DUNS, it's now the UEI, and the UEI is requested in and assigned by the System for Award Management, so also known as SAM. You can expect to use the UEI in the same way that you've used your DUNS. So for example, grants.gov changed the system field, so wherever it asks for DUNS, it now asks for UEI. Just know that if your organization previously had a DUNS and a SAM, you were already registered, then the system already gave you a UEI. So if you had a DUNS and a SAM previously, you have a UEI. You just need to find out who has that information. And then grants.gov is a website that many of you know for searching funding opportunities, and organizations as well as individuals can register to submit through this website. So registration for all these systems is free. There's detailed guidance available online, This website will get you started and allows you to check and see if your institution has a UEI and is registered in SAM. So these slides will be posted on our website, so you'll have access to all of these links and resources that you can refer to in your daily work. Okay, ERA Commons. Hillary went over this in game part 1, but this is just a refresher. Your organization must be registered, and individual investigators who are applying for grants must also be registered with individual profiles called ERA Commons IDs. These are unique identifiers that track all of your funding, your reporting, and then in January 2022, all key personnel on grants need to have them. And this includes any trainees on training grants. So for those of you that we work with when we're doing just-in-times or PPRs, progress reports, or new submissions, we ask you to make sure that the key personnel and the trainees all have ERA Commons IDs. This is a requirement. You should be affiliated with your organization somehow, and you should be assigned a role. There are certain roles like AO, which stands for Administrative Officer, and that allows you to search for and create new ERA Commons IDs. So if that isn't you, you need to find out who your AO is so they can create ERA Commons IDs for your organization. Login.gov, this is the US government's new platform to access many of the systems needed by grantees, including ERA Commons. It is a next level security, so it requires what's called a two-factor authentication. It will send you an email or a text with a code for you to access. So if you haven't set this up yet, I encourage you to do so. Tutorials with screenshots and videos to walk you through the process to register will be provided in the resource section for this class. And becoming experienced in this will prove valuable, as you'll likely need to help others from your institution do the same. So you'll continue to retain and maintain your ERA username and password after registering with login.gov. However, going forward, once you set up a login.gov, to access ERA Commons, you'll have to go through login.gov. So I know that was like super exciting. And this is the first and fastest section of the presentation. And I realized that you may not have questions until you really start to log in and find your way through these websites. However, does anyone have any questions or experiences that you'd like to share before I go into the other policies?
Yes, good afternoon, everybody. Good morning, wherever you are. Honestly, it's a shame on me because I never knew UEI is the same as DUNS number. Well, now I know. Thank you so much. I didn't know that. Yeah. The UEI number is same as DUNS number. I thought it's another identification.
Well, it is different, just to confirm. It's not the same number. It's just that SAM used to include the DUNS number and the UEI number already when you get registered. So if you're registered in SAM, then you already have a UEI number.
Okay.
Yeah, and if you're not sure, you can use that website that I shared on the slides. But if you previously had a DUNS number, then you have a UEI number.
Okay. Hello.
Okay. Thank you.
Hello.
Yes, hi. Thanks, Anne, for clarifying that, because but what I want to ask, the link that's only shared on the screen, if we click on those links and enter our DUNS number or SAM's number, will we get the EUI number? Because I know the SAM's and DUNS number, but I don't know. I'm sure we have those information, but I want to get them as well.
Yes, you should. You should see it.
Okay. Okay. Thank you.
You're welcome.
There's also a question from Renee in the chat asking, do we have to continue to maintain a DUNS number?
No.
That's right.
No, everything's kind of phasing out. You know, eventually you'll have to use the login.gov, you know, these kind of things. So the sooner you kind of get used to it, the better. The US government loves codes and forms and all sorts of, security next level things. So it's a two-factor authentication.
Yeah. One thing that I will share from our partners' experience, in case it's helpful to others, is that if you have received US government funding, then at some point, someone registered your entity in SAM. And we do appreciate that sometimes historically, US-based partners have been just creating these registrations for international partners without their involvement. And that is really unfortunate, because you should all be creating these for your own entity and maintaining them yourselves. So I would just encourage you, if you're not sure, to ask around. We can help you even like look up, and I think Holly included the link where you can check your entity's registration. So I encourage everyone to click on that. And then if you're in there and registered, you'll get sort of a data sheet, and that tells you who the contact is listed for your entity. And so you might find that it actually was someone who doesn't work at your entity that registered your organization. So as always, like, come to us with any questions that you have, but I would encourage everyone to explore that a little bit further for all of these. And then Adeni, I see you have your hand raised.
Oh, yes, thank you. I just wanted to add that I believe the DONS number was still operational until this year. I think it was phased out, and the UEI was introduced in its place, I think sometime in January of this year. Is that correct?
That's correct.
Okay, thank you very much.
Are there any other questions in the chat, Ann?
No, I was just posting. Oh, sorry, go ahead, somebody.
Yeah, what I want to ask, like if you want to renew your SAM's registration, I try to do that because ours will expire very soon, in 3 months' time or so. So I try to do that, but I see they're asking me to pay. Are they paying for that?
No, it should not be paid. And there are nefarious websites out there that are they're trying to collect money. So make sure you're on the correct website. So I would go to that link that I sent you. Unfortunately, there's scammers out there. You might get an email to click on a link, but no, you should not pay.
Okay.
Yeah, I put the link in the chat to everybody. sam.gov is the website. If it's any other website trying to get you to register or pay, don't do it.
Yeah, because even at UEM, Alfiato, I think they were asking for like a $300 or $400 registration fee, which is not correct.
No, yes, exactly.
Yeah, exactly. They asked for a fee for.
Exactly.
Sorry?
I said, I hope you didn't pay that.
No, we didn't.
We didn't.
No, we didn't. We just went through the website and tried to get the registration for free, and we did it. So we didn't pay for it.
Great. Great.
Yeah.
All right. Well, I'm going to move on. There'll be time towards the end. If you kind of think of a question, you're like, Holly's moved on, just write it down. We'll have time at the end. Okay, so now I'm going to dive into a policy that you may not be aware of, but like I said, you need to know what it is and how you as a research and administrator may interface with this policy. So this is called the NIH Financial Conflict of Interest Policy. And so the NIH is committed to preserving the public's trust that the research they support is conducted without bias and with the highest scientific and ethical standards. This regulation on promoting objectivity in research establishes the standards to provide a reasonable expectation, design, conduct, and reporting of NIH research is free from bias, resulting from investigators' financial conflict of interest. Financial conflict of interest requirements are included in that really dense NIH grants policy statement. So the sections that I've indicated here is where you're going to find information about financial conflict of interest requirements, as well as if you're prime or consortium agreements. And you'll have these slides and all of the links. So who's covered by this regulation? Each institution and each investigator that's connected to an NIH grant or cooperative agreement. So even if you aren't prime, and this includes US as well as non-US organizations. So what is a financial conflict of interest? A financial conflict of interest means a significant financial interest that somebody has that could directly and significantly affect the design, conduct, or reporting of the NIH funded research. And significantly really means that it would have a material effect on the research or impact the research. And please note, there's no exclusion of disclosure of financial interests for non-US institutions. So how is a financial conflict of interest identified? The regulation states that institutions need to assign a designated official or officials to review a financial disclosure. And so that person who assumes that responsibility, whether it's one person or a committee, the first thing that they will do when they review a financial disclosure is ask, is the significant financial interest related to the NIH funded research at all? If no, then it's not a financial conflict of interest. If it is, then they need to drill down a little bit further and determine the next questions. Could the significant financial interest be affected by the research? Or is the significant financial interest with an entity whose financial interest could be affected by the research? And if the answer to either one of these questions is a yes, then you have a financial conflict of interest. And I know this is a little confusing, so I'm going to walk through some examples to provide more context. So these are just some common areas where you'll find financial conflict of interest, you know, where your PIs have received funds from various sources. So your PIs may do a consulting service or a speaking service. And this example that I've given is a PI is consulting for a healthcare company that makes a device he or she wants to study in an NIH funded trial. So if an investigator is doing health related research, like many of your PIs, consulting or speaking where healthcare or industry sponsored are involved should be highly regulated. And the conflict of interest policy should be consulted before undertaking that. Another area is in gifts. The example I have here is a healthcare company that makes a device the PI wants to use in an NIH funded trial, gives the PI a monetary gift. Using Vanderbilt as the example, per Vanderbilt, individuals may accept gifts, meals, entertainment, social amenities, but no greater in value than $300 per year. And they cannot accept any gifts of any amount from any healthcare or pharmaceutical vendor. The next is, family personal business. The example I give here is the PI wants to include his brother's lab as a subcontract recipient on his NIH funded trial. Using Vanderbilt as a model, Vanderbilt doesn't allow any business relationships with a contract or a grant between Vanderbilt and a business in which the individual or even a family member has a financial interest. So if we go back to these examples and go through the financial conflict of interest determination questions, are all of these related to the NIH funded research? Yes, they are. Okay, so then the next question, could the significant financial interest be impacted by the research, or is the significant financial interest in an organization whose financial interest could be affected by the research? So in these examples, this healthcare company could be impacted by the outcome of the trial, which could cause bias in interpreting and reporting results. So if the trial is successful, the healthcare organization could financially benefit. And because the PI is connected to the organization as a consultant, he or she could as well. And so this sort of creates a bias. In the personal business example, could the fact that the brother's business doing the laboratory analysis bias the results in any way? Certainly you would hope not, but it does create unnecessary complications and should just be avoided. So as you can see, the relationship is entangled. It needs to be carefully assessed. So what are the reporting requirements when you have identified a financial conflict of interest? NIH has developed an ERA Commons module. So when you have identified a financial conflict of interest, the institution financial conflict of interest signing official submits a report, and it asks for things like who is the PI, the name of the entity that the investigator has a relationship, the nature of the financial interest, the estimated value, and a description of the financial interest and a description of the institution's management plan. So beginning in 2020, institutions were required to submit a copy of their financial conflict of interest policy in the institution profile module of ERA Commons. So this is for Prime. NIH funded recipients must submit the policy, and they must make it publicly available on their website to get funded. So not doing this can cause a delay in funding. So it's really important that the policy is submitted at the time when NIH is talking to you about the funding of your application. We do have an experience where one of our partner organizations primed an NIH grant, and they were not aware that they had to have the policy. They thought because we were their partner, they could use Vanderbilt. Because they're Prime, it had to be their own. And so it delayed the notice of award by several months because they had to create a policy. It had to go through their legal system. It then had to go to the website. So it's really, really important that if your leaders in your organization are really interested in priming, that you advise them and say, this is a policy, you must go ahead and get this started. So for consortium agreements, whether you are a subaward or whether you have subawards, it's important for you to know and establish which organization's financial conflict of interest applies to the subaward. So your consortium agreements need to establish whose policy applies. If you're working with a subrecipient that has a lot of grant support, then most likely you'll defer to their institutional policy. But if you're partnering with an institution that doesn't have NIH support, it's likely easier for you to just have the subrecipient disclose their financial interest to you, your organization, for determination of a financial conflict of interest. So kind of distilling down, what could be your role related to this policy? So again, just to recap, when you submit a grant as Prime, you are certifying to the NIH that you have a written and enforced policy in place that implements the regulatory requirements. You also need to ensure that the financial conflict of interest is submitted to NIH and posted on your organization's website. If an application was submitted by your institution, there is a way where you can say, we have one and we will post it. You'll need to make sure that by the time it's awarded, the policy has been submitted and posted. Otherwise, the NIH will not be able to issue your notice of award. You may also be responsible for ensuring investigators receive training about your organization's financial conflict of interest policy. The general rule of thumb and guidelines is every 4 years. You may be asked to develop the training or track the training for your teams. And then also you need to ensure that you are familiar with the financial conflict of interest in your subawards. Know through each subaward which organizational policy does that subaward apply to. So I know that was a lot. So I want to see if there are any questions. We have a lot of policies to get through, so I'm just trying to give you some basics. Any questions? All right. So just a brief discussion time. Does anyone have experience with the financial conflict of interest policy? Do you all know if you have one? What are the main elements? Can anybody share that? I think everyone's asleep.
No, we are not.
I put you to sleep.
It could also be for some of the larger academic institutions that your university does have one. It's just not something that has been widely shared or might not be on the website. For example, it might not be active, where every 4 years folks are having to certify that they do or do not have a conflict of interest. So Renee has shared, I assisted with the COI policy for Orem, uploaded to ERA comments, etc. Thanks.
Yeah, maybe.
Hello. Can you hear me?
Yes, Leonard.
Yes. We have one for our university, but it's actually not too skewed towards research. It's academic bias, but we do have one actually for the University of Sweden, and it is embedded in our administrative HR policy. It is not a standalone document.
Thanks for that, Leonard. I would also mention that Holly shared in the chat UNZA policy in Zambia. And if anyone else that has one would be interested in sharing, I think that
Yes.
Hello?
Yes.
Yeah, so for us at ULCHS, we have a financial conflict of interest policy. Is embedded in our the manual for research world, the operation manual for research awards.
Great.
Yeah.
I think from Zambia.
Yes.
Well,
Yes, please. I think from the University of Zambia, the financial policy of interest, I think there's a time that NIH had indicated that sometime last year that we'll not get our funding until we work on this. So it's a standalone policy. I think it's called Financial Conflict of Interest in Research and Policy and Procedures. So it was finally approved, I think, by the school in May 2021, and actually is put on the website. I'm glad to indicate that I was part of the team that was drafting this and came up with all this. So I was a bit involved in this. Yeah.
Yeah, that's great.
Christabel, that was, you all were the example I was sharing, that you all really had to work diligently, knock on doors, get the lawyers to review. You all did a tremendous job. And just, I think you can agree, for any of our partners in the class today, you don't want to be doing that as NIH is pressuring you. You want to do it ahead of time and make sure you know where your policy is. But it sounds like many of you have policies. They're embedded in your faculty manuals. That's great. So you just need to know where it is. You know, are you responsible for ensuring that it's submitted and posted? Maybe not, but just know who is. And are there any other questions?
Not a question, just a comment that Alfiato shared. UEM has a conflict of interest. It was revised recently and still needs to be approved by the faculty board. So I think that just goes on from your point, Holly, that these processes can take a long time before they get finalized. So if you don't have one in place, it might be something in terms of next steps after this training to get going so that you are ready when it comes time to submit a grant.
Thanks, everyone.
Yeah, my question is the policy that is entrenched in the organizational IRB. Will you consider that as the organization conflict of interest policy as well? Like,
No, because that's, I mean, it depends on what your research ethics committee is analyzing, but typically they don't look at the financial conflict of interest. I bet AKTH has one, Wall. I am confident they do because they have direct NIH funding. So you'll see to find out where it is.
yes, Alan, thank you.
Yeah. Thanks so much. Okay, so now we're going to have some silly fun because thank you for not falling asleep, but I know this can be pretty boring. Okay, so Holly emails you, I email you, and I ask you to put PMCID numbers on a bio sketch. You look at my email and you think, I don't know what she's talking about. I think she's just making this up. I think PMCID has to do with some sort of manuscript code, or you think, I know what Holly is asking for and where to find it. Hillary, we need the poll. All right, I don't know. I think it has to do with the manuscript code. I know what she's asking for and where to find it. Okay.
Option 1.
Okay. Somebody thinks I'm a liar. I'm just making things up. Oh, 3 people. 5 people. Oh my gosh. Okay. Okay. All right. I'm just making these codes up. Oh, okay. All right. I appreciate your honesty. So many of you don't know what the heck I'm talking about, or you think it has to do with manuscripts, but you're not quite sure. That is totally fine. That's why you're in this class. Okay, so PMCID numbers are related to the NIH public access policy. So not only is making published research funded by NIH publicly available an important opportunity to advance science and improve human health, the NIH must implement this policy and awardees must implement this policy because it's the law. The NIH public access policy applies to all final peer-reviewed manuscripts that arise from NIH funding, regardless of the amount of funding. And so this is the policy. It shares what to submit, the final peer-reviewed manuscript, when to submit upon acceptance for publication, when to make public, no later than 12 months after the official date of publication, and where to make public. And the National Library of Medicine, PubMed Central, also known as PMC. So once you submit an article through the system, it is given a PMC ID number. So ta-da! So that is what the PMC ID number is. It means that the article arose from NIH funding and it is made publicly available. So for the sake of time, I'm not going to go over the details of how to submit a manuscript, but just know there are several methods. And this website is user-friendly. And you can look up by journal what the process is. Sometimes the journal submits on the author's behalf. Sometimes the author has to submit. And you may be responsible for doing this for your investigators. If you click on the training tab, there are countless resources and videos to show you how to utilize the tools for managing your bibliography and how to manage public access compliance. This is a great website to share with your investigator and your study teams. So I'm not going to go into depth on database tools and searching today, but for everyone's sake, but I do want to highlight PubMed. Many of you are probably familiar with this, but this is managed by the National Library of Medicine and the National Center for Biotechnology Information, also known as NCBI. This is a great way to not only search for publications on a topic, but also you can find if a publication has a PMC ID number. So if we email you and say, hey, can you find the PMC ID numbers for your investigator on their biosketch, you can just go directly into PubMed and find it. And I've highlighted here an example of where you find this after typing in the search terms. I used one of my papers, and you can see there where it says PMC ID. That's the number that I need when I ask you for that. Another tool is the NIH Public Access Compliance Monitor. It provides an institution with the current compliance status of all the journal articles that are associated with the institution and fall under the NIH Public Access Policy. I do, however, believe this only applies if you are a prime award. I actually don't have access to this. I don't think Hillary and Ann do on behalf of VUMC. It's done at a higher level at our Office of Sponsored Programs. But to gain access to the system, users must be first assigned a role by an AO at their institution in NIH ERA Commons. So here's the link. You'll have the slides. You can see if you can access it. I tried to click on the link and it said I didn't have access. So just sharing that. So this is what it looks like when you submit an RPPR, or your partners like Vanderbilt have to submit the RPPR. We have to enter in all the papers for your progress report that were a direct result of the grant for that year. And you'll see that some show up as non-compliant. If any show up as non-compliant, it will result in a delay in your notice of award. So if you are administering a grant, you need to work carefully with your study teams to make sure, are you publishing any papers? We need to make sure that they're compliant. You can send them that website that I shared earlier so they know how to submit the manuscript. But as a research administrator, you just need to know that, that this can cause some delays. So again, distilling down to what could be your role, like we talked about in the example, putting PMC IDs on biosketches. Also in the RPPR, the progress report, all manuscripts related to the grant must be submitted and they must be in compliance. Lastly, to make your life easier, if the PI and the study team can keep tabs on their manuscripts, that will likely require at least some routine training and tracking from the research administration teams. Okay, questions on PMC ID numbers? I know I'm going fast, but I'm just trying not to, I'm trying to cover a lot in a short amount of time. Do you feel like you could answer that question now, that I'm not just making up a code?
I'm getting some yeses in the chat.
All right.
I'll also add something. If something is non-compliant and it's missing a PMC ID, it's the responsibility of the authors of the paper to submit that. So you would not have to submit that yourself, but you'd have to just remind the authors of the paper that, hey, you need to submit this in PubMed.
All right. So do any of you have experiences to share? Do any of you all have tools that you use? Anything that you'd like to share with the group related to PMC ID and public access? I will just share my personal experience that this is often something that I neglect for some of the grants that I run. And it is not a good feeling while you're trying to write your progress report and work with your teams to like have to track down these papers. And so it's something that, you know, I go, oh gosh, I've got to make sure that these are compliant. Hillary or Ann?
Yeah, I was gonna share my experience too. What I normally do when I have a progress report coming up is that a month before the progress report is due, I put a reminder on my calendar to log into ERA Commons, and I'll check to see if any of the publications are non-compliant. And that way, then the investigators have at least a month to submit it, because it normally takes about 2 weeks once they submit it to get the PMCID number. And so I try and put a reminder on my calendar before I have a progress report to, just go check and see if anything is non-compliant. And that way we have a little bit of time to resolve the problem.
That's great. Anyone else?
I was just gonna add that some journals, this just happens automatically. And so it's not always a process that the authors have to do themselves.
All right. Next policy, next question. Anne emails you and asks for RCR and GCP certificates. You see the email and you think, I don't know, is this some sort of computer course? I think it has to do with ethics training, but I don't know. And I know what Anna's asking for, and I know where to find it. RCR and GCP. What in the hee-haw is that? Okay. All right.
Hopefully when Anne sends her email, she will explain what those things
True, true. Okay. All right. We're still getting some answers. Okay. So most of you know, maybe it has something to do with ethics or, oops. All right. All right, moving on to the last policy. RCR stands for Responsible Conduct of Research, and GCP stands for Good Clinical Practice. These are required trainings under the NIH policy on protection of human subjects in research. So according to NIH, the NIH defines a human subject as a living individual about whom an investigator conducts research. Either the investigator obtains information or specimens through interaction with the individual, or they obtain data, identifiable data, or biospecimens. So identifiable data could be name, date of birth, address, that kind of thing. If you can connect the data or the biospecimen to an identity of an individual, then it is considered NIH human subjects research. There's this handy decision tool. I have the link there, and it's a questionnaire to assist you with determining whether your project involves human subjects research or doesn't involve human subjects research. So NIH has many policies, as you can see, related to human subjects research, but I'm not going to go into all of them. I'm just going to narrow down into a few that apply to common requests that you may receive as a grant manager. So as I described in the beginning of the segment, you've been asked to submit your team's training in RCR. This can be called protection of human subjects. It's also known as responsible conduct of research. Typically, the rule of thumb is that you need to do it 1 to 3 years. And there are several options, but one program that we often recommend for our non-US partners is TREAT because it's free, it's self-paced, it allows for multiple languages, and it has varying levels of courses. So all of your investigators on your NIH-funded studies should complete the RCR. The next one is good clinical practice. This is for all study teams that are engaged in NIH-funded clinical trials. There are other options for training online, but we also recommend TREE for this. For those of you who partner with us on NIH training grants, we're typically required to submit both RCR and GCP for all of our key personnel and trainees. So that's why we ask you all the time for this. Okay, so I know that was really fast, but what is your role related to NIH, RCR, and GCP? Again, you have to submit it at the time of grant submission in the just in time. You have to submit it at the progress report. And you will likely need to maintain training, some sort of tracking. It'll make your life easier if the PI and the study teams keep tabs on their RCR and GCP training. So, you don't get the email from Ann and then they have, a week or two to take the classes. And then also just monitoring compliance, making sure that everyone, all the key personnel, all of your trainees maintain their RCR and GCP. That could also be your role. If you have any interest in research, I highly recommend you taking them. It's really informative. I know Hillary and Ann and I, we do ours every year. It just helps to understand the policies. Okay, questions? I hope now you know what those acronyms mean, RCR and GCP.
Maybe while folks are thinking of questions, I'll just share that in terms of the policy for renewal, Holly mentioned 1 to 3 years. It's up to the prime awardee to determine what the renewal timeframe is. And so if you're a sub-awardee and you don't have your own policy, then typically you would just defer to the prime. A lot of times Vanderbilt, we just sort of impose that on to the sub-awardees, but it is to be determined by your institution, if that is an annual renewal or once every 3 years, for example.
Thanks, Ann. So do any of you have any training programs that you like to use? I mentioned TREE. Is there anything else that you like to use, or how do you keep track of these trainings for your investigators? Anybody have any tips? Uh-oh. Oh, well, you may need to type it in the chat.
Oh, well, I don't know if you can hear us, but the connection seems to be quite bad. Maybe if you could type it in the chat.
All right.
Thanks, Awal. Just type it in the chat.
Renee has shared that this is managed by our regulatory staff through an electronic system with reminders on when renewal refresher is due. That's great.
We don't even have that.
Our IRB does let you know.
Oh, that's true. Yeah.
But yeah.
Any other tips, tricks, questions?
Our team keeps a spreadsheet of all of our Vanderbilt staff and investigators that work on our projects, and we put it in our box system. And so we just that's a way that everybody can find it. And we just have the name of the person and either the expiration date or the date they completed it, something like that. And so that way, whenever we get asked for new certificates, we go to that spreadsheet first. We double check if anyone's expired, and then we ask them, hey, can you please renew your certificate?
And in-person trainings work as well. You just have to have a certificate.
Yeah, a lot of it is really up to your institution because the onus is on the institution to say, yes, we believe that with this frequency, the training is done, you know, with fidelity.
Hello. Yes, from our in KGH, yeah, most of our technical staff are trained on this GPC and they have the certificates. They are all filed here, where our study coordinator have them filed. As mentioned earlier, we do the same thing. We have the name on each file, dates of the training and the expiry dates. So when they are asked, they will just submit that, and when it's time for them to renew, to take again the training, to do the training again, they will definitely do that. But we have all those on track and filed as well.
Right, thank you, Samiri. Any others? Are there any training programs that you really like that we didn't mention?
I think I've got a list somewhere. I'll see if I can find it and I'll paste it in the chat.
Great.
Of free courses.
Yeah, TREE, like I said, multiple languages, Portuguese, Spanish.
It was great when NIH used to offer this training, but they no longer do.
Yeah.
It's unfortunate. Vanderbilt uses Citi, which you might have heard of. However, your institution has to pay to have access to it. So I don't know if I recommend that one.
Yeah, Leonard added to the chat, we conduct GCP regularly for our clinicians, more especially when a new project is introduced. They do a post GCP example after the training with certificates filed. That's great.
All right. So we have a few minutes left. I'd like to open the floor to any questions on anything that I've covered today. Anything you'd like to share? All right. Seems like now you're all very knowledgeable about all the acronyms and the codes and the policies. And these are not all the NIH policies, as many of you know. These are just some of the ones that I find as a research administrator I interface with. Adeni.
Yes, please. The RCR means responsible conduct of research. I didn't quite get the GCP. Is it good conduct practice?
Good clinical practice. So
Thank you.
for investigators,
Clinical.
Yep, that work on clinical trials. Exactly.
Okay.
Yep.
Thank you.
Mm-hmm. Any other questions? Renee, do you want to share what GCLP is?
Yes, I would like to do after training, and then the staff do the GCP exams and they fail. What do you normally do in your own situation if they don't pass the GCP exams?
They have to take it again.
Okay. And if they fail again, what do you do?
They got to take it again. It might mean that they need some mentoring. You know, it might mean that they need some face-to-face training.
Because the way the trainings are set up, it's sort of a learning and assessment process. So they'll give you, you know, slides, for example, to teach you the thing, and then you take the evaluation at the end.
GCLP is good clinical lab practice.
Thanks, Renee. Okay, so thanks everybody for your time and for your attention. I know this information is a little bland. Thank you for answering the polls and providing resources and discussions. So now we're going to take a break. Hillary, how long? A 5-minute break? 10-minute break?
I think we could do 10 today. I think we have enough time.
Okay, so 10 minutes. So that would be, yeah, in 10 minutes.
Sounds good. We'll see you all in about 10 minutes.
And I'll let him present. I'll let Eric present the slides as we get started. But as Holly was saying, we have a presentation today where we're going to walk through the closeout process. And then after that presentation, we've got an activity designed for you guys. So we'll go back to those breakout rooms like I started last time and wasn't able to fully complete that activity. We've modified those scenarios some, and we'll spend some time in breakout rooms where you guys can network and talk through some best practices on how to handle some scenarios. And then we'll wrap up today with a presentation on audits. And so throughout today's experience, we will pause for questions. I know I've saw you guys using the chat a lot. Feel free to ask questions throughout in the chat. We'll be sure to monitor that, or if you want to come off mute, you're welcome to do that as well. Before we get started though, since you guys know me and we spent some time together, I thought, Eric, you may want to introduce yourself and give us a little bit about your background and experience before we get started.
Yeah, thanks, Mark. Hi, I'm Eric Ingram. I've been at Vanderbilt since 2005, so doesn't feel like it's been very long, but I guess it'll be 17 years actually this month. So 17 years at Vanderbilt. My current role, assistant director, handle a team of accountants that works on the federal grants. So the U.S. Federally funded research grants that come to Vanderbilt. We do financial reporting, compliance reviews, and maintaining the balances of the grant. So ensuring that there's remaining balance and the grants aren't being overspent. Those are three of the larger things we do. I may have reached out to some of y'all in the past because one of the responsibilities we do have on the federal grants team is subrecipient monitoring. So if you all are involved with the contracts with VMC, we are required each year to reach out and obtain your audit reports, and we review the audit reports because part of VMC receiving U.S. federal funds, we have external auditors who do each year, and they want to ensure that we're doing our subrecipient monitoring. So they'll actually pull samples, so we have to submit your audit reports to them and review them. And hopefully we don't have, we have a good audit reports, good reviews, the findings. So if you haven't heard from me or see my name on emails, you've probably heard from other people on my team reaching out to you. There's somebody else in your organization who handles those audit reports.
All right, thanks, Eric. And so we do have a couple of learning objectives today that we hope you guys will take away from this session. So Eric, can you advance the slide? Yeah, so we want you to be able, after attending this session and being a part of this presentation, we hope that you can explain both the administrative, research, and financial closeout processes for U.S. awards at a high level. and then also be able to detail the roles of each of the various research administration officials during the closeout. So different people are involved in this process from most organizations, and understand the roles that they have throughout the closeout process. Again, as we get started, ask questions using the chat box or come off mute, but Eric was going to walk us through this presentation.
Right, so we're going to talk about when a closeout is due, but before we go into these details, I do just want to recap from a high level view, what is a closeout? So think about these sponsors are granting funds, be $100,000, it could be $1 million to your organization, and they're bringing those funds expecting that a certain set of milestones or work is completed at the end of a certain period. And so what they want to see is at the end of the period, they want to have a report back to them showing exactly how much that project cost to the organization. What was the scientific accomplishment or discovery that took place? As part of milestones that were designed in the grant. And were there any inventions, were there any other discoveries that could help future research? Maybe the sponsor wants to use for other organizations, or maybe your own organization. So think about a closeout as almost like a final exam. Like I've got a high school senior right now who's this is her final exam week. And so after 4 years of high school, she's going through and letting the teachers know what all she knew, what all she accomplished and learned as part of her year there at school. So that's really the basis of the sponsors asking for that report. It's about accountability, making sure that the funds were used how they should have been used and there was progress made. So in terms of when a grant is due to the sponsor, closeout is due once the project ends, which is pretty self-explanatory, but there can be a difference between a closeout that's due at the end of a project, say 5 years, or you may have a grant that requires a financial report or progress reports due annually. And so you really have to be careful and read the terms and conditions of the grant, the contract. And that grant contract, it will spell out the reporting requirements. If you go through and you see that it's not really clear reporting requirements, that's when I would definitely encourage you to reach out to somebody, an organization, reach out to the central office, or reach out to the sponsor to make sure that you all are aware of the dates, that you're planning ahead for those dates. You don't want to be caught in a position where the sponsor is emailing you or asking, hey, we missed a report, it's delinquent, can you send it to us? You want to definitely be on the front end of any type of closeout reporting. So we talked about the end of a project. Also, another scenario is if you have a researcher who's transferring to another organization. I don't know how often that happens where you all are. I know it here at Vanderbilt, it's rare, but we do have probably once or twice a month, there could be a researcher, a principal investigator who's going to lead for another organization, most likely in the United States, sometimes international. And so when that PI's principal investigator is getting ready to leave, go to another organization, they have to wrap up the grant that was housed at Vanderbilt for that period of time. And so what we'll do is we'll actually prepare the closeout documents, and with a new early termination date, whenever the PI is leaving to go to the other institution, and we'll wait for the sponsor to open up that reporting so we can submit that report. So it's a report that you're probably not planning for, because you have, let's say, June 30 as your anticipated end date of the project. That PI could be leaving April 30. So you have to do things a little more like a smaller window for that reporting. And again, the third point is about making sure you understand the terms and conditions of the grant or contract. So that will be, should be pretty clearly visible when you have to do the reporting, and it does vary by sponsor. So a lot of our population of our grants are NIH, but if you have maybe other non-US sponsors, then they require earlier turnaround dates than what a federal sponsor would require. Okay, so if, as been mentioned in earlier classes, I definitely want to touch a little bit on uniform guidance. So I know y'all are non-US organizations, but in the United States, when we receive US federal funding, we have to comply with what's called uniform guidance. Uniform guidance is the law book. It has the rules and regulations that subrecipients have to follow when they agree to accept US federal funds. You can Google it. There's several sites out there. There are .gov sites that have good explanations and list all the rules and regulations. There's a section, this for closeouts, so it's 200.344. It's actually really good information to read. And part of the uniform guidance, it talks about if you're a recipient of federal funds, your closeout should be turned in no later than 120 days to the sponsor. If you're a subrecipient, the requirement is 90 days. And so think about the recipient versus a subrecipient relationship. Recipient is receiving the federal funds directly from the US federal entity or directly from the sponsor. In most cases, that's, okay, so my body's breaking up.
Yeah, Eric, your audio is kind of coming in and out a little bit.
Okay.
So you may want to turn your camera off just to.
Okay. All right. If that doesn't help, let me know and I can switch to a different router.
Okay. It sounds better already.
Okay. So a recipient is where you're the prime recipient of another sponsor. You have 120 days to turn around that report. A subrecipient is where there's another organization that has received those funds from a federal sponsor, and they've subcontracted out to your organization as a subrecipient. So the reason the difference is that there's a difference in the number of days is if you think about if as a prime recipient, you have 120 days to turn around the report, as part of that closeout review, you also need to receive any invoices coming from a subrecipient. And so the subrecipient needs to have that information to you in enough time to report it and include it in their financial report. So the subrecipient is 30 days or less than if you're the main recipient. Hopefully that makes sense. If not, just drop some questions in the chat. We can talk about that.
Yeah, Eric, this may be a good spot to just pause and ask questions. If everybody can maybe just put in the chat if they've participated in a closeout previously, what your experience is, that may be helpful for us to get that information. And then if you did, if you have participated in a closeout, if you can tell us if you were the subrecipient or the prime for that award, that would be helpful. So if you guys can just enter that in the chat box. Okay, it looks like we've got a couple folks that have participated in closeouts as both a sub and then the other as a prime. Has anyone else participated in a closeout? Okay, I think this is one of those kind of building on what I talked about, one of the topics last time, being proactive and planning or preparing before you get to a closeout. If you haven't participated in one yet, some of the actions and steps that you're taking today can help prepare you for the closeout. And so as Eric kind of goes through this next session of the presentation, be thinking about some steps that you can take. So when you do get to that closeout in that pretty short window of time that he just talked about, may be helpful for you all to have prepared in advance to help lessen the burden or the load of the work that needs to be completed in that short window. Looks like some other folks have participated as well.
I think more people have than they realize. For example,
I was just thinking that sometimes it's like just a request for certain input in the process of closeout.
Yeah, it may just be sending a final invoice or sending. You know, it may be more simple on a subcontract level, but that's still a step in the process.
I think that's a great point, Hillary. After we finish this presentation, I might ask the same question, see if anybody else says, yep, I have completed some of the pieces of this. Okay. All right, Eric.
All right. Yeah, so this next slide talks about the federal sponsor or the sponsor. They want to know, as part of the financial reporting, you're letting them know the expense amount that was used on the project. And as part of that is they're going to look to see how much have they paid you up to that amount up to the end of the project. So if you have charges that were moved off during the course of the project or during your review of the closeout, items need to be credited. And now you're showing that your expenses were less than what's already been paid. And they're going to ask for that money back. So you'll have to send in a check, or if you have a drawdown system, refund the money back to the sponsor. They're going to want to know, they're going to see that the total payments match to the penny what you all are reporting on the financial report. And that's for a cost reimbursement. We call it cost reimbursement grant. Most grants, at least on the US federal side, are cost reimbursement. The exception is there is a payment mechanism or billing mechanism called fixed price. So if you're a subrecipient, and especially international, you may have some of these, you may have seen them. It's a fixed price contract. So fixed price is where there's a set amount, let's say $100,000 for the 12-month period of the contract. And that the payments will be made based upon milestones, not actual expenses. But as you enroll patients, as you do outreach, conferences, you'll bill a sponsor and they'll pay you in installments. Now, at the end of that period, because it's fixed price, there's not an expectation that if your expenses are less, that you would have to refund money. The fixed price amount is what it is at the end of the contract period. And that amount is negotiated beforehand when the contract is before the contract is executed. So there should be a pretty good sense of what that work is going to cost. And so it can also turn out that expenses, hopefully not the case, but expenses could have been greater than a fixed price contract. And because it's fixed price, there isn't going to be additional billing. It would be in a situation where you would voluntarily cost share to clear the deficit, but you would not be able to bill a sponsor for additional expenses on a fixed price. All right, so the financial status report. So Mark talked about it just a few minutes ago. The PI and the departments are to review the expenses, approve expenses in the closeout. The best time to be doing this is during the budget. Really the best time to prepare for closeout is way before the closeout is due. And so as you're starting, when you receive your grant, or when you have your executed contract, go ahead and be really familiar with the terms and conditions. We talked about making sure you know when that report is going to be due. Make sure you understand the budget lines in the contractor grant, so you know that what you can spend, the items you can place and charge on the grant contract. That's really important. And that you're doing a regular review of expenses as they post to your general ledger system. So here at Vanderbilt, we ask that the departments review their transactions on a monthly basis. We actually have a system where they go in and they can check off that the transactions in that month are reviewed and approved. I don't know if you all have a system like that in your organization, but there should be some type of review that takes place. And so by the time when you're nearing the budget end date or the project end date, you already have confirmation, you have documentation that you review the charges and they're appropriate to the grant. And you're not having to go back and remove things months prior. That can be really problematic. So the PI and departments, they're responsible for reviewing the charges because they're really the ones that have the first-hand knowledge of what those items are and if they are appropriate or not. The finance office, your central office, typically is generating that report. They're the ones that are working with you. Once you've confirmed the charge is appropriate, they're the ones that would be compiling that actual sponsor's report, filling out the report, submitting it into the sponsor's either website or emailing it to the sponsor. This also would be the same office that's would be putting it together invoices if you have a contract instead of a grant. And then internal systems. So I know everyone's internal systems, I'm sure, vary, but you should have at least an internal system where you can be confident that you're tracking the expenses as they are charged, and a review can take place. I know with the contracts that VMC has with subrecipients, when that contract is being prepared, there is what we call a risk assessment. And so we actually open up a website that's owned by Vanderbilt called PEER, P-E-E-R, where the subrecipient goes through and they answer questions about their audits, answer questions about their financial systems, if they're able to, if they have a good financial system, if they're able to maintain charges. And so it's something that we do on the front end to make sure that the infrastructure is in place with our recipients. They have the ability to manage the expenses, make sure that they're abiding by the rules and regulations set forth by the sponsor. And if they're not in place, we would consider that to be a high risk. It doesn't mean that we couldn't do the contract, but what we would do is the next step is to see how we can mitigate the risk. And so, at Vanderbilt, my experience, at least with the contracting team, is that they're not looking to grade other organizations. If they pass, fail, can we do work, can we not do work with them? It's really a relationship in which if that organization needs help building infrastructure, building some internal controls, at Vanderbilt, we try to help them do that and give them the assistance and aid they can so that we can have that relationship, because there's a reason why Vanderbilt's subcontracting work to these organizations. All right, and the last point is, again, expenses must meet allowability. They have to be allowable based on the terms and conditions of the grant or contract. Allocability, we'll probably talk about this in previous slides, but allocability means that the charges are allocated. So if you're purchasing travel for students or researchers, that person is traveling to a conference, well, is that conference benefiting more than one project? If so, then you should allocate that travel charge appropriately, depending on how the travel, what proportion of the travel benefit each project. And you can think of it in simpler terms of when you have effort, so somebody's time is being billed, or their salary is being billed to the project. If their time is being spent on multiple contracts, multiple grants, making sure that is allocated correctly. There's a percentage that's being charged to the grant contract. It's not their full salary, if not their whole time is being used for that one grant or contract. And then consistency. So making sure that you're charging, sponsors grant or contract like you would, even if it wasn't sponsored, or if it wasn't the U.S. federal funded project. You're consistent across your institution's rules in terms of what you can or cannot place on grants or contract. And you're charging the same rate. You're not charging a sponsor a higher rate than you would if it wasn't sponsored. All right, to kind of recap that a little bit, the cost principles, again, if you go to uniform guidance, I definitely encourage you, if you haven't been to look at uniform guidance, if you're receiving U.S. federal funds, it's a great resource. You look at the uniform guidance, or sections that talk about the cost principles, what's allowable to be charged to a U.S. federally funded project, what's not allowable. And of course, I know you all have more than just U.S. federal funds. So the ones that aren't U.S. federally funded, again, it's really knowing the sponsors, their own cost principles, what's allowable based on the contract grant. Late charges. So at Vanderbilt, I would say probably the most work that's done in terms of a closeout review is reviewing late charges. And these are charges where, let's say your budget period ended April 30. But you still are receiving invoices from maybe a vendor of lab supplies, or you have a subrecipient on the same project, and they're submitting their final invoice to you. Those invoices may be coming in May and June. You may not pay them until June, possibly even July. And so you're reviewing the charges to see, are these appropriate to the budget period that ended April 30? They could be, and they may need to be included in the financial report, and you wouldn't want to miss out on that. But you also need to make sure that if charges are continuing to post or to hit on the grant contract, that they are for the allowable project period. They're not for effort that actually was for May or June. Those need to be moved off, and those cannot be included in the financial report, in the closeout report. And third tier subcontracts. So if you all are a subrecipient and you have a subrecipient going to another organization on that same grant contract, really the key is keeping track of the invoices they submit to you all, making sure that you have all the invoices. And if you're approaching the end of the project, have that dialogue with them to maybe know from them what's the expectation of when you should be receiving that final invoice. And so you can be on the lookout for it. And if it's going to be more than, let's say, 60 days, it could become problematic in terms of your closeout. So you want to have that expectation set. And if it's a situation where they're not going to be able to have it to you within 60 to 90 days, they can have that conversation with them, let them know you need to have it because we have to include it in our financial report to our sponsors. So a lot of times you should have in the contract that you have with the other organization, it should say on the first page when the financial report is due. Typically for Vanderbilt, at least, those are 60 days. Sometimes I've seen it even 30 days or 45 days, depending on the sponsor's requirement for a financial report. Okay, cost sharing. Actually, we talked about voluntary cost share. So voluntary cost share, you don't typically need to include in the closeout report. It's usually when the project has been overspent. But some grants and contracts do require cost share reporting if it's required cost share or the required match. And so it's going to be a situation where the sponsor agrees to give you $100,000, the organization $100,000 to do the work. But they also ask that the organization spends $20,000 on maybe somebody's effort on work salary or purchasing equipment. So if that's required match, that would be included in the closeout. And so, say that because you would need to keep track of the required match during the budget period. Something else that you don't want to wait till the end of the closeout to be looking at. Be mindful of the required match that's in the contractor grant and keep track of that. The indirect cost. For most of your organizations, if it's US federally funded project, your indirect cost is probably going to be 8%. It could be different if it's a non-US federal project. So the indirect cost is when we do our review in our central office, we're looking to make sure that the indirect costs calculated correctly. And this is also something that our auditors were audited once a year by external auditors. They'll actually take a sample of the indirect costs on projects to make sure that amount calculated correctly based upon the expenses that posted a given month. Our indirect costs at Vanderbilt indirect cost runs each month based on the charges that post. Program income. I don't know if you all have program income at Vanderbilt. It's pretty rare. We don't have many projects with program income. But if you do have program income, it's required to be reported in the closeout. There's a section for, I would say, most closeout templates I've seen from sponsors that have a couple lines where you would report the program income. If you're not familiar with program income, or if you don't know if you have program income, definitely reach out to your central office. There's good information online, but basically program income is if you are, if you have an activity for providing a service to the community, That service is funded by the sponsor, like salary or materials. If that service is generating revenue, so for example, if you're putting together a conference, and that conference requires registration fees by attendees, that those registration fees would be considered program income. You need to report that program income to the sponsor. Depending on the grant or contract, typically the program income isn't going to, in all likelihood, it's not going to reduce the award amount. It's usually allowed to be spent in addition to the budget. But the sponsors do want to know about it. They want to keep track of the program income. And the closeout is a place to do that. All right, so again, we talked about who has responsibility. Ultimately, it is the PI's responsibility, along with the department, to ensure that the charges are appropriate. When auditors come to Vanderbilt, at least they will actually have, I don't know if you've been in some of these, they'll actually have principal investigator interviews. So I'll ask the principal investigator, ask the researchers in the lab, can you explain to me what you all did, what you all charged the grant, and they'll go through possibly a list of transactions just to make sure that the researchers who are actually doing the work agree and understand that those charges were used, those items were used for that contract. And I think another important note here is documentation is really crucial. And so you want to have documentation that the charges have been reviewed. You have documentation of the invoices that are being paid. So if you have an item that is sampled by an auditor, you definitely want to have an invoice, a packing slip, a timesheet, something that documents the amount that was charged to the grant or contract, that matches what was charged and is for an item or activity that was pertinent to the project. So PI's departments have responsibility for ensuring the report is correct. The central office would have the responsibility of submitting it, making sure that's submitted on time. Talk about documentation. So we use NIH at Vanderbilt because, as an example, because it's, like I said, most of our medical research grants are funded by the NIH. The retention record retention policy is 3 years. At Vanderbilt, we actually go a little above 3 years. So it's just to say that your sponsor may vary in terms of what they require for you all to retain for your records. And it could also vary from your organization's record retention policy. But your organization's record retention policy should be at least as strict as your sponsor's policy. So if the sponsor's policy is 3 years, you don't want your organization to allow you to discard records before 3 years is over. Makes sense.
Yeah, and Eric, I just dropped into the chat, but just to get everybody thinking about how the content relates to the work that you all do. What is your record retention policy? How long are you keeping the documents that support the research at your institution?
Anyone out there care to share? I put this in the chat, but I know also often at a country level, the Ministry of Health, for example, might require a more stringent time period, like 10 years, for example, historically in Mozambique.
Yeah, and I know at Vanderbilt, it's dependent upon the sponsor. And we actually have some sponsors that require us to retain the records forever. There's no end date. And so this is one of our policies that becomes a little tricky when trying to read through it, because the amount of time that certain documentation needs to be kept varies depending on the type of award or which aspect of our institution it's helping support. So it can go from 3 years all the way up to 7, 8 years can be very common in our own policy. Someone asked, doesn't
Yes.
GCP require retention of like 10 years? I think, and that's what you were saying is yes. That's
Yes,
quite common.
hello.
Yes, Leonard.
Hello. Yes, for us, it depends on the sponsor. Like for clinical trials, the ones we are conducting right now, we are required to keep the documents for 20 years. You know, an archive is built and it's being funded. There is fund allocated, which will enable us to keep those documents for 20 years. But it depends on the sponsor's requirements. And then what I did not see in your closure, I don't know if that is applicable to your own types of research, like asset verification and depreciation. I don't know if that is also inclusive in your closeout, because we do them here.
Can you repeat that? What's your partner closeout that was mentioned here?
Sorry, Leonard, just to confirm, I think your point was that there are different types of records that are kept for different lengths of time. And so, you know, are there, based on the type of research it is, does that have a different timeline? Do financial records and those sorts of things have a different timeline? And Daphne in the chat also brought up this difference that, you know, it's her understanding that for them, research related data is 10 years and 7 years for financial records.
And so Eric, that's probably pretty similar to VUMC, where it depends on the sponsor and the type of record that you're looking at to determine the length of time that the documents need to be retained for. And as administrators, that's just one of the other hats that we have to wear, is be familiar with our policy and the lengths of time that those documents need to be retained for. Because as we'll talk about when we get to audits, you know, audits can come in and review all of these records that you have. And so if you need to retain documents for X amount of years, they could go back and ask for that documentation from X number of years ago based off your policy. And it could also get you into a tricky situation where if you've retained documentation for longer than you should have, then that could potentially be part of the scope of an audit, where they could pull and review documents from decades ago if you still have those on file. So
That's
just something to be mindful of.
That's a great point, Mark. If you have the documents, if you all haven't discarded the documents, even though you're no longer required to, if the auditors ask for it and they are available, then you're required to give them to the auditors, even if you didn't have to keep them.
Yeah, it looks like someone had put in the chat, in Mozambique, finance records and clinical trial documents both need to be kept for 10 years. So while that's a long period of time, in some ways it might simplify things that everything needs to be retained for the same amount of time. That may be a little helpful as an administrator to keep that time frame in mind.
We do also appreciate just how cumbersome that can be when you're talking about multiple studies. You know, in Mozambique, I know best practice is like these binders and binders of all of the data locked away in cabinets. And, you know, over the course of 10 years, that requires quite a bit of space. So we do appreciate the challenges that this can present.
Are most of the participants, are you retaining the documentation in paper form, or do you have an electronic process where you store the files electronically, or a combination of the two?
Yeah, we keep the records in physical files for 10 years in current storage, and for more 5 years in depth storage. So we have to keep them for 10 years.
Gotcha.
Yeah.
So that really does turn into filing rooms then. not necessarily just cabinets, I'm guessing, for many of you.
Yep, that's it.
I used to work at a school where we had a filing floor where you didn't really want to go down there because it was actually in the basement and it flooded often, and you just had a smell about this room, and that's where you had to go to sift through the records when auditors wanted it. And I can totally relate to that. And from my own firsthand experience having some sort of filing system, I think I talked about this last presentation, of like how you can retain and find these documents when you need to, is super helpful and important, so that you can at least know which binder or which cabinet to be looking through, if you've got rooms of documentation.
We have them separated in folders, and we separate the folders in groups of projects or find donors. I mean, it's easy to get them because they have identifications on the bottom of the folders.
Perfect. Sounds like you got a good system.
Yeah, it is, but as you said, the smell is not good, and it's not a good place to be.
For some reason, these record rooms, they're at least my experience, they tend to get to the basement, and then they flood, and it's just not a great smell.
Well, and Alfiato, I love your use of the phrase. So you have your 5-year current storage, and then they move into 5-year death storage, which I think is
yeah, is a storage which we don't use the documents often.
That's right.
But
Yeah.
we consult it when it's needed.
Yeah, I
Most
think
of the time
smart.
it's not needed, but yeah, we never know.
Yeah, that's right.
Sure. Anybody else have anything to add before we move back on to the presentation? All right.
All right, so this slide is talking about, we really honed in on the financial report, but keep in mind that depending on the terms and conditions of the grant contract, there may be other reports required. And so some of those commonly required reports is a progress report. So that's really more of a scientific, the narrative. The sponsor wants to know what was done, what was accomplished, were the aims met for that grant or contract. Then you also can have a final invention statement. So we talked about this earlier. If you have a discovery, if there was something that it could be potentially intellectual property, something that was discovered and is useful, the sponsors are going to want to have a list of that as well. The final invention statement. I think the final progress report, I believe, is covered in a little more detail in the next class. So you'll hear a little more about that. But just keep in mind that there are other reports in addition to the financial report. So the progress report, this is a scientific report. It's, I think, would be typically required the same time as the financial report, 120 days from the termination of the grant or the award. You can also have, like financial reports, there may be a requirement that it's not just submitted one time at the end of the project. It may require annual. I think it's common with Vanderbilt. We have a lot of grants that require an annual progress report. And so there's probably little leeway or little room for receiving an extension. If you're running behind on the progress report, they may not give you that extension because you have another one due in 12 months anyways. So they want to have that report completed on a pretty regular basis. This talks about the different aspects of the progress report. Again, did the project meet the original aims of the sponsor? Something else we haven't talked about is publications. So you would have to include publications that were part of the, that were produced as part of the project, part of the research. Mark, if you have any other experience maybe with progress reports, the non-financial side of things on the closeouts.
I don't have a lot. Most of the work or the support that my team does is around the financial piece, working with you and your team. So that's kind of my expertise. Does the gains team, do you guys have any experience with some of these other topics on this line?
Oh yeah, we submit a lot of progress reports. And just a shout out for next week's class. We have a whole session on progress reports.
We don't want to steal your thunder.
Yeah, so we will talk about all of these things next week. So I don't think we need to go deep today, but I appreciate you mentioning it.
So the vision statement, again, this is a report that shows what items were invented. It should be a full listing, this all inclusive. And I believe you have to submit the report, even if there was nothing, you have to submit a 0 item report to a sponsor. They want to see they should completed and thought about those inventions. Maybe Mark, has anybody had inventions in their experience with grants contracts, these organizations? Maybe somebody's familiar with these reports.
Yeah, if you guys want to just drop that into the chat, if you've had an invention statement, any inventions that have come out of the work that you guys have done.
Yeah, I'm curious. Personally, on my projects, I have not.
Yeah, same here.
I've seen a lot with some of the biomedical informatics awards. It would make sense, right? Some of the coding software, maybe novel uses for algorithms could be something that would be, even though we don't think of it as like a mechanical invention, something you can hold in your hands, it's still definitely an invention. You know, it could be considered intellectual property.
Most of our projects are clinical research projects. And that's what everyone, I think, mostly works on. So we may not have anybody who's dealt with this.
All right, so again, this is, if you want to submit this, you have to submit this report more than likely based on the terms and conditions. You would list all the inventions. There can be, so if you'll have training grants, I think some of your organizations do have the training grants. Of course, that would be typically excluded from the invention statement requirement, as well as fellowships. They're going to be really based on your research projects, your program projects, your collaborative projects. And this is an interesting note. So at Vanderbilt, we do have, it's called CTTC, so Center for Technology Transfer and Commercialization. And so as researchers come up with inventions and discoveries, they should engage with the CTTC. And in that organization, or that area, the department does help them if there's potential commercialization for that product, they can help them with that. So they're not just on their own. There may be efficiencies that with a central office that they can come up with in terms of marketing the product. They have other potential collaborators in the country or in the world that they know that could use that product. So if you may not have that office. Some of your large organizations probably do. And if you don't, I think this could be a need for one of you, a good item to reach out to somebody in your central office and see if that'd be worth creating.
Yeah, and Eric, to that point, at VUMC, or Vanderbilt, we're not creating, say, if we invent or discover a new drug, we're not creating those drugs at Vanderbilt. Rather, we'll license that compound or the new discovery out to organizations that do specialize in that. And so we have this centralized team who has relationships with some of those large players in the pharma space in the United States, so that we can leverage those relationships whenever discoveries are made. And it does provide some sizable revenue for our institution. And so definitely something to consider as those discoveries are made, and the work that you're doing is what the licensing opportunities are. Not that you have to go and create new facilities to create the drugs or anything like that. Just the discovery itself can lead to some financial benefits for your organization.
All right, so this is the slide that nobody really wants to see, but there can be consequences, and there are consequences if these reports aren't submitted on a timely basis. They become delinquent. So you can have revocation of expanded authorities. Some of your organizations may already be granted expanded authorities, which means probably one of the best benefits of having an expanded authority is that you can have automatic carryover from budget period to budget period on your grants or contracts. And that's really helpful, especially considering what you budget in terms of needing funds. The amount needed each year really varies on how you scale up a specific project or how long it takes you to recruit a lab, maybe find vendors to provide supplies, items. So it's definitely helpful in terms of keeping a consistent grant if you have that expanded authority to allow for carry forward. So you don't want to lose that. Withholding of sponsor payments. So we talked about the 120 days and the 90 days. If you have a contract and you are submitting a final invoice after the number of days that are required in that contract. So let's say in Vanderbilt's example, it's typically 60 days. If we receive a final invoice after 60 days, there could be an issue in us being able to pay that final invoice. So you don't want to risk that. When we're the prime recipient, the 120-day rule is in effect. And if we submit the final report after 120 days, and it turns out that final report included expenses that we had not yet asked for reimbursement, well, after 120 days, for the U.S. federally funded projects, those go into what's called an expired status. And so we actually have to make an exception and request funds from the expired project. It's a lot more hassle, a lot more steps that take place rather than invoicing during the project period, during the budget period. So there's no guarantee if you submit late reports that you'll be reimbursed for expenses that are legitimate. You can have a unilateral closeout. I've only seen this happen one time where the PI didn't submit the progress reports, didn't submit the final invention statement, and those reports were pretty far delinquent. What the sponsor did was they just shut everything down, and they went across the board and they just completed the reports, didn't give the department any time to report on maybe expenses that should have been, that weren't billed yet but needed to be billed. And that can also, think about it, it can be a negative thing for a principal investigator, obviously. If the sponsor is getting soured on the relationship, then it could potentially impact future funding for that investigator, as well as the institution. So if the institution isn't submitting reports on a timely basis, the sponsors are going to take note, and they're going to have less confidence that the organization can handle their financials, handle the projects, and then you're probably going to have fewer funding opportunities in the future. And then the last thing, so the audit findings. We talked about audit a few times here. At Vanderbilt, we have an external audit. It's a large single audit that encompasses all the federal expenditures. And we don't want to have findings, but if there are findings, that audit is published. It's open to anybody who wants to go out to the internet and look for it. It's a public document. And if you have findings, again, it can negatively impact your future funding for sponsors down the road. So there are real consequences to submitting late reports. All right, Mark, I think you were going to maybe do an activity before we maybe take extra long.
Yeah, before we get into the activity, are there any thoughts or questions from the participants about maybe late reports or any of the content that's been covered so far?
Yes, I still need more explanation on this revocation of expanded authorities. I'm not clear on this.
So expanded authorities is not project specific. It is given to institutions, organizations. And so if you have a contact in your central office, would ask them if your organization does have expanded authorities. Typically it's marked in the grant or contract document that your organization does have expanded authorities, and it'll entitle you to several things. So I mentioned the ability to have automatic carryover of remaining balances, but also when you have expanded authorities for research projects, you're not required to submit a financial report every year at the end of each budget period. You can actually submit one at the very end of the project period's competitive segment, which is typically 4 to 5 years. Those are, in terms of what I've seen in my role in central finance, those are the two big advantages of having expanded authorities. Also allows you to re-budget, I think up to 25% of your original budget without asking for the sponsor's approval. Another thing you can do is it allows you to have to internally approve pre-award spending. So expanded authority is, they allow the institution, they give the institution the ability to review and approve things on their own instead of having to go to the sponsor every time that you want to make a change. And if an organization doesn't have expanded authority, I think you can ask them what would be the steps, is something that they would want to do to obtain that.
Okay, thank you so much.
That's a great question. It comes up quite often in the classes that I teach, is questions about expanded authority and some of the audits or case studies that we review in some of the classes. When that expanded authority is lost, what's the burden to the institution? And the answer is it's quite significant. Oftentimes, if it's a large institution, dozens or more people have to be hired to complete additional work. Any other thoughts or questions here so far? All right, Eric, I'm going to share my screen if you can stop sharing yours.
Yes, I have one. In case you go beyond the 60 days deadline, not actually by your fault, maybe due to failure in banking system transactions. I mean, will you be granted exception?
So you're talking about submitting a final invoice to the sponsor or to the
yes,
to the
maybe
contract party?
You want to make some financial returns.
Yeah.
Or let us say the bank you are dealing with has got some breakdown in their system. You try to do this 5 days prior to the deadline, and then you have some breakdown with the banking system and you are unable to do the transfer as against the deadline, not due to your own personal fault, but due to maybe technical issues or SWIFT, problems with SWIFT and whatsoever in the country you are from. Will you be charged in relation to that? Or are there any rooms for exemption in such cases?
Yes, I think the best policy there is to just be sure you have open communication, open dialogue with the other party. So if you're starting to run into those problems or you anticipate there could be issues, that you're letting them know as soon as you can, so that you're setting the expectation. They know that there may be a 5-day delay or a week delay, and then ask them for, sometimes it happens to us as well. So we have to, there could be a part of the project that all the patient enrollment data isn't available yet. And so we reach out to the sponsor, explain the situation, and we ask them for a filing extension. And so if the original filing deadline for the report was 60 days, you may ask them, can you give us 70 days? Can you give us 75 days? And that doesn't require a new contract or even an amendment. It's just, we simply take their confirmation in an email as documentation for us, for our auditors, that they granted a 10, 15-day filing extension. So again, you would need to ask for that, of course, before it's due, that filing extension.
That's why I'm saying this, like in our country, we've had those problems before. In fact, the bank will not even inform you that they have challenges with, except maybe the sponsor send a final notice to you, notification that we have not received this. And that's the time maybe you get to the bank and then they tell you that they will have a breakdown with our system, blah, blah. So, and had they informed you prior to that time, you can notify, it's easy to do the notification. But let's assume you sent it and you have the opinion that it's gone, the bank tells you that. And then, except for you to know from the other end that they have not received anything, and then you go to the bank, that's the time they tell you, no, our system has been down for 3 days, we are sorry, blah, blah, blah. So if you find yourself in such situation, what do you do?
So I think, if I'm understanding correctly, I think once you know that that's an issue, that's when you need to alert the sponsor that there is a problem and you're requesting that filing extension.
Yeah, and
Is that what you're asking?
Yeah, sorry, thank you, Eric. I think also just documenting all of this as best as you can so that when you're requesting the extension, you can also show the communication from the bank, for example. And I think increasingly they're trying to be, aware of these added challenges that a lot of our international partners are facing. So I think, as Eric said, just so long as you can let them know as soon as you know of the problem with this documentation to back up what's happening, I think they're trying to be, reasonable with these extra challenges that a lot of you all face.
The 60 days is typically, let's say, requirement in a contract. We mentioned earlier the uniform guidance, so the federal rule is 90 days as a contract relationship. So I say that because if your contract is requiring a final report in 60 days, but you know that there is a strong likelihood that these are going to be problems, it's part of the negotiation of that contract before it's even executed. You may go ahead and ask that be changed from 60 to 75 on the front end. Just give you a little more time there.
Okay, thank you so much.
All right, if we want to transition then into our activity, I'm going to drop the link in the chat to our Jamboard for our scenarios. And so we'll need to have 4 breakout rooms created, and I'll share my screen so we can see what these look like. You guys see my screen? The Jamboard screen?
Yes.
Okay, thanks. So again, just to navigate us on how this tool works, we've got 4 different scenarios and they correspond up to the top on the different slides in this tool. So scenario 1 is on slide 1, and if you scroll over, scenario 2 is on slide 2, and so on. There are 4 scenarios. What you'll do is once we put you in your breakout room, you will read through your scenario together as a group, and then you can answer how you would respond, some best practices in your area, perhaps policies or internal controls that you have, some of the experience that you have in handling these types of scenarios, and you can add those by inserting a sticky note. So over on the left-hand side, there's the square, kind of hovering over it there. You click on the sticky note, you select the color, you can type in your response and then hit save. Then from there, you can reposition your sticky note on the screen and then keep adding those. So what we're going to do is we're going to spend 20 or 25 minutes out in our breakout room. So we've got some time for you today in our agenda, so you guys can spend some time talking through a scenario with your group. We'll come back together and we'll talk through the scenarios together. So if you're comfortable and you have somebody that is comfortable being the spokesperson for your group, that would be great if you can select or nominate that individual as you go through the scenarios. Again, the scenario that you work on will be corresponding with your group number. And if your group does finish the first scenario that you have, you can feel free to just go on to the next scenario and read through that and maybe have a discussion about it. I'll just ask that you not add sticky notes to the other groups' scenarios. That way, it can get a little tricky if multiple groups are working on the same scenario at the same time. But we'll spend 20 or 25 minutes in the breakout rooms. We'll come back and we'll have a discussion about these scenarios. And Hillary, are you able to set up the breakout rooms for us?
Yes, I will. So remember your room number, and that's the scenario you're going to complete. So room 1 completes scenario 1. Great, I'm going to open them up. If anyone has any issues, let me know. And then make sure to click that link right now before we go to the breakout rooms, but I'll also broadcast the link to everybody as well.
Okay.
And how long did we want, Mark? Sorry, if I missed that.
Let's go 20, 25 minutes, somewhere in there.
Okay, sounds good.
And Hillary, are you able to see if there is a group that maybe somebody from your team, or it looks like Eric joined in one of the groups too?
Yes, I think I put everybody in. Tried to put at least one person in each group.
Okay, it looked like I was group 4. And is there anybody in there from group 4, or should I hop in?
You could hop in if you want to, just to make sure that they.
Okay. You may have to send the.
Let me see if I can do it again.
Nope, I found it.
Okay.
I'm gonna hop in. All right,
Okay, sounds good.
Okay, bye.
Hi, Hillary.
Hey guys, did you have a problem?
Yes, we can't reach the scenario.
We seem not to have read scenario 3.
Oh, okay.
So I'll ask you if you could share with us scenario 3.
Here, let me put did you get the link or no?
I didn't get the link.
Okay. I just put the link in the chat. So you should be able to click that. Do you see it? Do you see it or do you need me to share it?
Yeah, if you can help us share it.
Okay, you can't see it?
Yeah,
Okay.
from my end, it can't be. I'm failing to read it.
Oh, okay. Hold on. Let me share my screen then with you.
I can read. I don't know if you can hear me.
Hi, Leonard. Yeah. Okay, so can you guys see now?
Yeah, we can.
Okay.
I can see it.
Great. So this is the scenario that this group should look at. It says, during your review of items that have been charged to a US federally funded grant, you notice invoices paid for printer ink. You know that printer ink was not included in the budget for the proposal. What steps should you take to confirm if the charges should or should not remain on the grant?
Oh, wait, class. Me, I'm in class.
What do you guys think? What should we do about the printer ink?
Hello.
Hi, Bilia.
Yeah, hi. Sorry, I had a trouble network today. Yeah, from my own side, I think like for a printer ink, since you have 8% overhead cost, you can use that to pay for the printer. Since printer ink is not included in the budget, you are not supposed to pay from the grant funds.
Yeah.
About the cost of the printer. Unless if I has other funds that will support that.
Yeah, no, I think that's a great answer, Bilia. It's possible, though, that
No, sir.
Leonard, did you want to add something?
Yes, sir. Yes, sir. Yes, sir.
Hello.
Hi.
Yes, the printer ink, it's Sifiso here from Oram.
Hi, Saviso.
I'm saying on my different view, normally that printer will be shared by other projects. It might be a co-funding, but which maybe we might need a prior approval to update the funder to say, this is the split and this is the plan that the projects are co-funding and we require to purchase this. If maybe you can get a prior approval of co-funding on that, if you've already seen that it's there.
That's a great idea. Because maybe it might be that, you know, the printer is being used directly for the project. You know, maybe you're printing case report
like
forms.
ICF forms.
Yeah, exactly. Like, what if you're printing forms and it's only for that study specifically? In which case, maybe a portion of the cost can be used. That's a great idea.
Yeah. Well, yeah. What if the cost of the ink is inclusive in the total cost of replenishable?
Sorry, say that again. Inclusive in the cost of what?
Replenishables.
Yeah. It might be that this is just a supply cost that you can justify the expense. Here, let me finish typing Sifiso's thing. To share cost of the ink among projects. Printer. And I'm also going to add another option is that maybe the printer is only being used for one project. It's possible. You know, it's possible that it's only one printer and that everything that you're printing from that project is only being used for the one project. So in that case, I think it's an allowable cost.
Yes, you can also
Am I
explore
the
this option.
one? Am I the one missing? Am I the one missing the question?
You want to look at the question again?
I thought we were supposed to. I thought we were supposed to find the steps that we need to take before confirming that the charges are wrong given or something.
Yeah, that definitely says the question. I think we've been talking about it in all different ways. What do you think we should do, Christabel? Or was that somebody else? Or was that?
Yes, yes. Yes. Can you hear me?
Yep. I can hear you, Leonard.
Yes, I will first check if the printer was actually used for the project. I mean, the ink was actually used for the project. And if that is confirmed and we check the budget and found out that it is not an inclusive cost, maybe we can use the overheads to settle that. I don't know. We can get it out of the budget and send it to the overheads, the indirect cost.
Yeah.
That could be one. Another could be you could seek permission from the sponsor, permission in order for you to include. I mean, you can give justification on the reasons why you got this ink, though it was not budgeted for, and then you can seek permission for it to be included on the budget. That's another step you can take. But if permission is not granted, then you can use your overheads to meet that cost.
Yeah, I like that idea. Anyone else have any ideas?
Maybe I'm thinking of the same line where if you discover that it wasn't really budgeted for, we ask the hosting institution to cover that cost through the overheads. Because I don't know how others do it, as the heads are usually sent direct to the hosting institution. So to avoid audit issues, we don't tamper with audits, we send them as they, but we can always rehearse with them. So as we send them, they pass clear that part.
Yeah, I think that's a good idea, Christabel. Asking either the funder or if you're a subcontract, the prime institution about the charge and if it's allowable. Sometimes it's okay to rebudget the funds. So for example, if the printer was only being used for the one project, then you could make a case that it should be allowable cost for the project, and just provide a justification for rebudgeting of funds. I'll make one more note. Okay, I think we've talked a lot about this one. Do you guys want to look at a different scenario? Oh, that's it. Maybe we can talk about this one in the leftover time that we have. So the principal investigator approaches you with a month left in the grant period. They notice that there is a large remaining balance left and they would like to purchase supplies. You are not sure if the supplies will be received and used by the time the grant ends. Should these supplies be charged to the grant or not? What things should you consider in making this decision? What do you guys think?
Well, it
okay, go ahead, Leonard.
Yes. For a month, like in our own scenario, it will be practically impossible for you to do those procurements because our procurement policy is a bit protracted. It normally takes around 1 month to 6 weeks to complete the cycle. So it is virtually impossible for you to do such a procurement. I think what you might do in this scenario is to let your PI know that it is impossible, and then if they can ask for grant extension or implementation period extension, then if that is approved, then you could include. But in our own scenario, you can't because you cannot even complete the procurement process in a month, except if you have said extension.
Yeah, that's a great point. Like, are you planning to continue with the work for the project? And if so, you would request an extension on the grant. And in that case, the supplies could be allowable and then received in the time of the extension.
Yes. All right.
Safiso, were you going to say something?
Yeah, so from my end, I will consider a lot of factors. So first of all, I would have a conversation with the PR to know the length, at what point they intend to use the supplies. Because if you have 1 month remaining in the project and you want to purchase supplies that might go more than a month, there should be some justification to that. Also, you could look at or past requests. Let's assume the supplies they requested over the period and how it were used. That will also give you a clear picture of whether what they are requesting will be used in a month or more than a month. So considering those questions, let's assume it can be used in a month. Definitely you can charge to the grant. If it is something that will be used after the grant has ended, then we could consider splitting that maybe to overhead to cover up the portion of it that will be used for after the project has ended can be charged to indirect.
I like that idea. Anybody else have any other ideas?
So, but also to manage the project effectively, the PI mustn't also be aware of the funds available in the last month. So what we normally do on our side, we have a monthly meetings where we update them in terms of the financial status, what was budgeted, what has been actually incurred as actuals, and what is remaining as a variance. So if that is happening monthly, so they kind of know that we're tracking the spend and this is the areas that have the remaining funds. and how they can be utilized, but also aligning it to the activities of the project. If the project is still to be continued, we always apply for the no cost extension because the aim is to achieve the activities of the project. So yeah, it will be among those lines that the PI should be kept by the finance person informed on a monthly basis so that they'll know what is happening on the project in terms of the spending, and also align it with the activities of the project to say the remaining, is it gonna be used on the activities? If the activities just gonna overlap by the month or whatever it is that's gonna be overlap by, we therefore request from the fund that there no cost extension.
Yeah,
Yeah,
that's great, Sifiso.
I agree with him too. One option is the expectation for no cost extension. And then the system of tracking should be able to allow the administrative officer to know the requirements before that particular time.
Yeah, exactly. Make sure that they're aware throughout the process. All right, guys, our room's gonna close here in 30 seconds. Does anyone want to talk about the ink, the printer ink situation on behalf of our group? I might call on somebody then. Okay, we'll see you back in the main room.
That was fun. I'm excited to see what all the other scenarios came up with. We had a lot of contribution.
Yeah, it's one of those things as a facilitator, you can see live how the participation's going. And so you can like cycle through and see the responses from the other groups as it's going on. And it looks like there's a lot of good stuff on the various scenarios. I'm going to share my screen again so we can see the first group here. Got quite a few sticky notes here. The first scenario was we just received a subrecipient invoice from University XYZ for charges related to a subcontract for your organization's US federally funded grant. What are the steps that need to be taken to confirm the invoice is appropriate and should be charged to the grant? And so would somebody from that first group like to talk about a couple of these or hit some of the highlights from your conversation?
Group one had Afiato, Betty, Bilia, Daphne, Gabriela, Jimena.
What about you, Eric? Does anything stand out on any of these responses?
So the responses are really good. It sounds like people are pretty accustomed to reviewing invoices. A lot of good answers. Really, the dates. So make sure that the dates correlate with the contract. You make sure that the invoices are for the period that you can charge that particular budget period on the grant. Expenses are in line with what was proposed, what's in the budget. You know, if there are any expenses that look out of the ordinary, I think that's a discussion you would have with the principal investigator, and probably would require open dialogue with the other party. Why those are included in invoice.
That's great. And so one of the reasons why I like to use this tool is you guys can have this to refer back to after the session. If you want to use it as a training or teaching point with your own teams or your staff, you can have this, and you can definitely pull some of these nuggets out, because a lot of several of these scenarios have a lot of sticky notes with a lot of good ideas or suggestions that were shared. And so for the sake of time, I'm going to keep us moving along here to
One
scenario.
One more point, Mark, just real quick. You definitely want to be sure that the invoice has a signature from an authorized official, and there's a certification statement testing that those expenses are appropriate. Not that somebody's creating an invoice. That's something that when we're audited each year, that that's tested. That the invoices that we pay have that statement on the invoice included from the other part of the invoice payment bill.
Okay, good to know. Good best practice or things to take away for sure. The second scenario is the principal investigator approaches you with a month left in the grant period, and they notice that there is a large remaining balance left, and they'd like to purchase supplies. You're not sure if the supplies will be received and used by the time the grant ends. Should these supplies be charged to the grant or not? What things should you consider in making the appropriate decision? Would anybody from group 2 like to jump in and share some of the highlights from your conversation?
Edmund, could you walk them through it, please?
Yes, so thank you. Yeah, so we had a cross-cutting views in scenario 2, let you see on the sticky notes. First, we agreed that with such a given circumstance, we must consider a variety of factors. One is that we only have 1 month left on the budget, and so we want to ensure that in as much as funding is available, but we want to ensure that the supplies to be purchased are allowable and they're also allocable to the specific projects before we can consider option of charging it. Another point was if the supply can be attributed in 1 month, say aspects of the research, then we have to follow the relevant proper financial procedures just to ensure that we are on course with the expenditure. We also thought about considering the remaining time on the grant, so that we want to be sure that if you charge it to that grant, you're able to execute it or not, or whether there will be a need to go for no cost extension. So as you can see, these are the various things we discussed from scenario number 2. Another point was to consider implementing systems that ensure that the expense, for the remaining part of the year projection at the beginning, to ensure that spending earlier in the project. So we got to consider implementing systems that ensure the expense projections at the beginning of the project to ensure the relevant spending. And so we also said that we must consider if the objectives of the project have been met. If not, then of course there's a need to request for no cost extension in order to have more time to use supplies and achieve it. But there was another scenario we consider where if there is a seeding project that may most likely succeed this project, then maybe we could ensure, find a way that we cost sharing between the 2 projects, so that whatsoever new project can be able to utilize the remaining supplies, provided that project succeeds the other project. So these are just a few things we discuss from the perspective of scenario 2.
Yeah, I think you guys did a really good job of coming at this from different perspectives. And what about this, or what about this scenario? I think that the first point is really important, to make sure that the expenditure follows the direct cost guidelines and within uniform guidance, making sure that the expense would be both allowable and allocable to the specific project that's paying for it. That time element is something that, if any of us were auditors, we would want to look and review those charges that were at the very end of a project that looks, suspicious, or at least a red flag would go off of, why are you buying things at the very end of the project? Is this project really going to benefit, or these supplies going to be consumed or used by this particular project? And then the other points that you all made, I think, are really relevant. Understanding it's not necessarily a black or white, yes or no, you can't do this. You need to come at it from different perspectives, or sometimes we say different lenses. If you wear glasses, what are the various perspectives that the research team or the investigator may have as to why this expenditure could be appropriate for the project? Eric, anything to add to this one?
I think that is a really good point. If you do think that may need an extension, to cover some additional activity, then be on the early end of that request. You don't wait till you're right at the end of the project or budget period to request that extension.
Perfect. All right, good job. Thank you for participating, Edmund. Scenario 3, anybody from this group willing to share some of the conversation?
That was my group.
Okay.
Go ahead.
I can go ahead.
Yes, go ahead, Chrisabel. Thank you.
Okay, I'll say something and you can add if I'll leave one or two things.
Perfect.
So our scenario, basically, we were asked if during your review of items that have been charged to a US funded grant, you notice that a payment for printer was made. However, you know that a printer it was not included in the budget proposal. So what steps are we supposed to take before confirming if the charge should or should not remain on the grant? So we agreed to say the first stage is you go back to the grant proposal to just ensure that you are really correct in the decision that you make. So you look at the proposal, if you discover that it was really not charged, not budgeted for, then now you start looking at what steps to take. So the first step that we identify was that we needed to confirm if the printer ink was being used by the project or for the purpose of project implementation. So if you discover that that was the case, then you can try and allocate it to the IDC. Then if not, also you use the IDC to cover the cost of the printer ink since it was not included in the budget. Then the other one that we agreed was you request permission from the funders or provide explanation to share the cost of the ink among the projects who are using the print. So this is a situation where your printer where it's seated, a lot of people are using it. So instead of you just getting the charge as the project, you can share with other people who are using the ink. Then the other one is that we agreed to say if the printer is being used just for the project, it could be an allowable cost. All you need to do is now justify why it should be charged and why it should be paid to the cost, because this was being used for the project. Then the other one that we agreed was we need to check with the sponsors or the hosting institution to see if this can be charged to the overheads. So you agree with them, either the hosting institution or the funders can allow us so that this one is charged to the overheads. I think unless I left out something, these are the points that we picked in our group.
Yeah, I think you guys hit the highlights there. I mean, you want to determine if it's something that should be included in your indirect costs rather than a direct cost and a direct expense. And generally speaking, the majority of the time, things like printer ink or office supplies are going to fall under indirect costs rather than directly charged to projects. There are some exceptions, and those are, you guys touched on this, review your agreement with your sponsor and your award, see what was budgeted, look at the details of that documentation, because there are examples, and we have these regularly at VUMC where there are some exceptions to that, and there may be line items in your budget that would allow for this. If not, the majority of the time that's going to be included in your indirect costs. Eric or anybody, anything to add to this one?
Yeah, I just think if you can anticipate these types of charges, it could be questionable, considered administrative. The best time to discuss those with the sponsor is on the front end, right before the grant or contract is executed. So it's explicitly listed or labeled in the agreement itself in the budget. That way you're covered. It's already in the document.
Perfect. Good job. Thank you. Thank you for sharing. All right. And group 4, This scenario was you're new in your role and recently learned that one of your PI's projects will be closing out later this year. What are some of the things you can do to prepare in advance for this closeout? And I was part of this group and we had several folks jumping in, but Emmanuel, do you mind sharing some of your thoughts?
Sure. So we talked about submitting the final invoice and reviewing the accuracy of the final invoice before we submit it to the donor for disbursement of funds. We talked about submitting the FFR. Some people mentioned that they submitted an FFR on a yearly basis, and others mentioned that they do it on a quarterly basis, but they still have to submit a final expenditure report towards the, I think for us anyway, it's 90 days after the close of the project, where we have to submit a detailed expenditure report for the different program areas, and ensure that those expenses and the ceilings that are set for each program area is met. And for the FFR for us, we have to submit and ensure that the expenses matches the amount of money that was dispersed, because a lot of CDC grants, we don't really work on reimbursement. We worked on a quarterly drawdown, and then we spend the money, but we provide them with a forecast. So we have to do an FFR on a quarterly basis. And whenever we submit the FFR, it has to match the amount that we drew down from the payment management system so that no funds are badly spent. And then we also have to do at the end of the project an inventory report where we have to inform the donor of any sort of equipment that costed above $5,000 and send them a list and make sure that all those items are properly tagged and identified within the institution. We mentioned that we also have to start preparing for the technical report and ensuring that that is submitted on time. And I do think that there's one last one. This is watching all the NIH closeout training materials, just to kind of get familiar, not towards the end, but throughout the year, of what will be required for the closeout report.
Yeah, a lot of great stuff. Thank you for sharing and kind of recapping a really good conversation and the group that I was a part of. And it sounds like all four groups had really good dialogue. So thank you all for participating. Hopefully you learned some best practices or perhaps some takeaways, maybe a little bit more about your colleagues in the cohort who might be an expert on one section over another, something like that. So thank you all for your participation in our activity. We've got a few minutes left and we've got a couple slides on audits that we want to touch on. Eric, are you able to present the slides here at the end to wrap us up? All right, perfect. So let's see the slides now. So when we're talking about audits, we're gonna focus on external audits for the next couple of slides. At VUMC, we retain, or we have a team of internal auditors as well. But when we think about external auditors, we wanted to start off by defining what perhaps their objective could be, and that's to determine that an organization is using the specific award for the authorized purposes in compliance with all statutes, regulations, and the terms and conditions of the contract. So that's why we've referenced several times today. I'm sure you've heard this as a theme in many of the sessions. Review the terms and conditions of your award. That's because that's what auditors will come in and review, the terms and conditions of your specific award, which may be different, amongst other awards that you have. And that's what they're going to look at. So we have at VUMC these best practices kind of outlined down at the bottom of this slide, and what to do if you're ever contacted by an auditor, or steps to take to be aware of in the audit process. And so I think that we wanted to share this with you all as best practices that we have at VUMC, because we think it may be something that could be beneficial to you. And so at VUMC, what we advise our staff, if they're ever contacted by an auditor, they need to reach out. First step is to reach out to their leadership team, their administrative leaders, in their area, as well as VUMC Finance. We have a team dedicated in VUMC Finance that are available to help support our research teams through the audit process. One time in a presentation, I made the mistake of saying they enjoy audits. They clarified with me that the team does not enjoy audits, but they are very familiar with the process. They understand the questions that are being asked, what fields or what data they're looking for in reports, and what perhaps some of the concerned areas may be for the institution. So we try to leverage that team internally whenever possible. If you're asked questions as part of that initial contact, we advise our staff not to answer those questions specifically without guidance from their leadership teams and from VUMC Finance. The reason for that is responses, while it may seem like a simple, easy question to answer, your response could be taken out of context, or you may misinterpret what's being asked of you, or perhaps the report that you think can answer their question may have additional information that could potentially expand the scope of the audit or expand the review in that audit. So working with your leadership or your support structure to answer questions rather than going that alone or trying to answer those questions alone. Regular communication, touched on this in my last presentation, but having regular department staff meetings for your research teams are important. Having the appropriate documentation along with those expenses or the business processes are essential when you get into an audit scenario. They're not going to just come in and look at a financial report. They're going to go in and look at the details behind that report. They're going to want to look at the invoices, the packing slips, the receipts, the supporting documentation for your salary expenses, et cetera. So having those regular communications and proper documentation is important. And then lastly, as an administrator, it's our responsibility to know where to find our policies at VUMC. So you have some tool for understanding your policies at your institutions, as well as understanding the sponsors rules or the federal regulations around the agreements that we have. So understanding the rules of that's associated with the awards that we have at all times. And that can be, again, cumbersome, tricky, because different types of awards, different rules for different agencies or different organizations. But ultimately, if we're receiving the funds on behalf of our institution, it's our role as administrators to understand what we can and cannot do with those funds. Okay, you want to go to the next slide, Eric? Eric, can you advance to the next slide?
Maybe he froze.
You might have. Let me see if I can share my screen real quick. Just have a couple more slides to finish up. Can you guys see my screen now?
Yes.
Mm-hmm.
Okay. All right. So when thinking about audits, we have whole presentations on audits. We tried to simplify things down here for you guys today. But when working through an audit, there needs to be a clear understanding of what the scope is of the review. For example, are they reviewing a specific award, a specific project, or perhaps the auditors are reviewing a specific period of time? For you as an administrator going through that audit, understanding the scope is a very important first step in working to complete your audit. Secondly, understanding prior to the audit that there may be external auditors. Finance can help coordinate preliminary meetings with those external auditors. Oftentimes they're familiar with what's going to be asked, even the type of questions. Our central finance team is familiar with what types of documentation the auditors may work for. So that's another reason why we try to leverage their knowledge and expertise in those audit scenarios. But included in the audit could be meetings or interviews with the PIs, the principal investigators, as well as administrative officers or that administrative support to discuss both the review and the plan for completing those preliminary requests, whatever those reports or that documentation is.
Hey, Mark, we had a question just come up from Emmanuel. Do you provide the scope to the auditor or is it provided to you?
Yeah, that's a good question. And I think from my experience, the auditor is going to provide us the scope. They're going to come in and say, this is what we're looking at. We want to review and audit a particular award. We're going to review a period of time. These are the types of transactions we want to review, et cetera. Eric?
Yeah, and a lot of times the auditors are being asked by the sponsors, if agencies, U.S. federal agencies, or if you have your in-country agencies, these are the things that for this year, we want you all to focus on when you're auditing all of your clients. So it'll be kind of a standard type of audit that they're looking at because they can't audit everything. So they want to choose the things for that year that they want to really look at and scrutinize.
Perfect. Great question. Thank you for asking that, Emmanuel. Again, the auditor is typically going to be independent of the sponsor. To Eric's point, they're going to be working on behalf of the sponsor as a third party. And audits are going to be based on the terms and conditions in the award agreement. So that's what you're going to be audited to, are the specific award agreements. If the terms aren't correct for some reason, you want to work immediately with your central offices or your support teams, whether it's a pre-award or post-award office, to amend the award agreement so that the agreement is updated at all times. And I know at the UMC, this is ongoing work that has to take place as the scopes of projects change. Then budgets, et cetera, may change based off of the new aims or changes to the award agreement itself. There are a couple of types of audits. Uniform guidance audit is an annual audit that's conducted externally or conducted by an external firm, and organizations that receive, Eric, is above 750,000. Is that the correct amount?
That's right. The current threshold is $750,000 of U.S. Or of expenses from U.S. federal funds. So it's based on your expenses for the fiscal year. That is a threshold. So if you're getting close to that threshold to meet that, then definitely have a conversation with your central office. Probably need to be preparing for you're required to have a single audit in the near future. And it's quite an undertaking. So it's probably be a few decisions that would need to be made by the organization on how to prepare for that, and if you actually want to go above the threshold or not.
Yeah, so that's an important distinction. If you think you're getting close to that $750,000 in U.S. federal awards, this requirement of a annual single audit can be a sizable expenditure. So something that your leadership needs to be aware of, that it's a requirement, and make the appropriate decision for your organization. Your sponsors themselves can also audit at any time, sending a representative to review the work that's taking place at your organization. And then again, I touched on internal audit. At VUMC, we have an internal audit office that also review a sample of our research projects on an annual basis. Last slide here. Wanted to leave you guys as we wrap up today with a best practice that we have at VUMC that I think may be helpful to you all. It's called the Research Compliance Experts. These are faculty members or investigators that have significant NIH grant experience. So they're very versed in the research and the administrative requirements associated with that research. They're willing to work to help train their peers, other investigators. They help educate other researchers or research teams about federal grant compliance issues. So they stay on top of that. They work with several of our central offices to disseminate information and changes that may be happening at a national level. They act as advocates for compliance. So it creates this culture of compliance at our organization, led by more senior faculty members, helps to shape that culture at Vanderbilt. And they also can function as a peer trainer in tandem with some of our finance staff to help educate individual faculty members, whether they're new faculty members, perhaps they transfer from another institution and they need to understand some of the differences or rules specific to Vanderbilt, or perhaps it's a senior faculty member, but they're new in research. So they help to train and function in that peer trainer role. This has been a program going on for quite a while at Vanderbilt, and we thought it could be relevant to your organizations and perhaps something that you all may want to take away as at least a talking point for leadership in your area to see if there's interest in starting up something like this. So I know we're a couple minutes long on time. I can stay around for questions. I think Eric, I don't know about your schedule, if you have a couple minutes, but if not, thank you all so much for your participation today in our activity and your great questions and dialogue. Hopefully you found this presentation helpful and beneficial, and we'll be sure to share the slides with you all as well. Thank you.
Thanks so much, Mark and Eric. If anyone needs to leave, you're welcome to go, but if there are questions, people
it looks like
can go
Christabel,
ahead.
you have your hand raised. Christabel, is that an old hand raise, or do you have?
I have a question.
Yeah, go ahead.
Can I go ahead?
Yes.
All right. I wanted to find out if you could help, because I think up to now we have failed to find in our grant, our notice of award, it's indicated to say if you have delayed to do your audit, you are supposed to send you are supposed to notify someone by, I think it's by NIH or something. We try to, the only thing that is put in the notice of award is the address, like the physical address where we're supposed to take letters. But now we thought, is it possible for us to have an email address? Because besides that, we had our audit and our audit was finalized and the report filed, but we still have it, we have not sent it. Do we have a direct link for someone who's dealing with project under audit under NIH? If you have an email, I would really appreciate if you can share that.
So you're asking if now that you have an audit that's completed, you're ready to publish it and share it with the sponsor? Is that right? You're asking how to publish that or who to share it with?
It sounds like they were going to be late with it, and
late with the audit report.
With it, and she was asking about the ideal contact, because in the NOA it just listed an address. Eric, Mark, I don't know how you all would respond to this, but my first thought is to contact your grant management specialist that is also listed in the award. They are like my go-to with any questions like this. And while they may not be the individual that would be handling audit specific information, they could point you in the right direction if it wasn't them. But Eric, Mark, I
was going to suggest the same thing. I'll reach out to the GMS first. If you don't have a response from the GMS, maybe resend them the email and possibly copy the program official. You don't want to bother the program official too much when it's more financial things, but if you're not receiving a response from the GMS, you can do that.
And in case it's helpful, Christabel, they used to put that information at like the very, very bottom of the NOA, and now they've started putting it in like a sidebar to the left on like the first or second page. But it should be in every NOA.
There, Christabel.
Perfect.
All right, thank you.
Are there any other questions from anyone?
All right, sounds good. It sounds like we'll wrap up, everyone. Thank you so much, Mark and Eric, for your presentations, and thanks everyone for your participation in class today. And we will see you next week.
See you
Yeah,
next
we'll
week,
get
everyone.
these documents uploaded to the website and I'll add the recording to the YouTube channel. I do at some point want to break down the subrecipient questionnaire. It's a shame we didn't have more time, Eric, but maybe I'll message you some questions or some challenges that we faced with our partners on that. But for the sake
Yeah,
of,
sure.
don't get into it right now.
That's a whole, there could be a whole other class or two on subrecipient monitoring.
Right?
It's a
I mean, I
big
really
deal,
think we could have a whole session just breaking that thing down.
for sure.
But we certainly appreciate everything that you all shared today. And I know it was so broad, all of it. I'm sure that you all will want to sit with those slides and kind of review it all. And then just let us know if you have more questions. But otherwise, thanks everybody. Have a good rest of your Tuesday.
Bye, everyone.
Bye.
Bye,
Thank you, Eric.
Thank
We're
you.
seeing you for the first time.
Yeah, we've emailed back and forth. See each other.
Yeah, exactly.
I love it.
Y'all take care.
Bye. Thank you.
Bye, everyone.
Bye.